Emergency visit, which is also called limited exam, it is a problem-focused visit, meaning often a patient has a tooth that's hurting them, where they're like, doc, this has really been bothering me, what are my options? So what we'll do at that visit is we'll take an X, we'll do a basic exam, we'll assess what's going on. If it's generally limited to maybe just a couple of teeth, maybe 1 or 2 teeth, we'll address those at that time. And often during an emergency exam, usually what happens is either this. It's a patient that's not in pain, but maybe they've broken a tooth, but there's enough tooth left where we can do a crown. In some cases, maybe they will need a root canal that day along with the crown built up, but that's something that often that we can do. The other would be, like I said, usually somebody's coming into pain or having some swelling. If that occurs, often what we will do is we will get the patient comfortable, get them out of pain. If the tooth needs to be removed, we'll do that. If there's not a lot of pus, or we call it fluid in the area, often we can bone graft at the same time, maybe even place the implant if that's something the patient desires. Or if they're not necessary to do all those things, we can at least pull a tooth. We bone graft everything that we pull. One of the reasons being it helps to maintain bone. And secondly, if anybody has actually been to the dentist, if they've ever had a tooth pulled and they've had a dry socket, extremely painful. How do you treat a dry socket? Well, in our office, we don't necessarily say put that old paste that they used to use. We actually use bone graft material. We do all forms of bone grafting here to actually restore a site. So again, using emergency is usually broken down to a person actually has maybe a part of tooth is broke and maybe they need a filling or a crown, or they're having a lot of pain or swelling, and we often either do the root canal and fix the tooth, or we have to take it on out, pull it, etc. And if we have to pull a tooth, we give your options from that point on. You choose us because one, we actually have a variety of experienced doctors here. All of us have been doing dentistry for over 20 years. So there's pretty not too many things that we have not seen. You come on in, we'll see you, we evaluate you as quick as we possibly can. Often I have to admit, if you do call, if we get you, and it's an emergency, even if there may be a slight wait, we'll still try to get you in as soon as possible, but we'll professionally evaluate you, give you your options. And most of the time, whatever options that you want, we can actually treat you with one of those options that very same day.